Hi, I'm Dr. J, and I want to talk to you about one of my favorite things in the world is how to make men healthier. And one of the ways that you do that is you improve the testosterone level. I have been working in this field since 1987, and believe it or not, it gets more and more fun all the time because when you do this work, guys feel phenomenal. And so increasing testosterone levels safely and naturally is just, it's a big deal and it's a ton of fun. You can do it naturally without drugs sometimes. The easiest way is avoid drinking out of plastic containers, cheap ones. They're really good, high quality plastic that you can get in a sporting goods store. That's reasonable, but cheap plastic in water bottles and stuff, it can create a blockage of normal testosterone production. Cheap meat, like cheap hamburger at a fast food joint, has a lot of hormone in it. Some of those agents in there actually block the production of normal testosterone, and that could be a problem. There's stuff in the air you breathe, you can't avoid it. But the things that you can do, staying away from plastic, don't eat cheap food, exercise. If you exercise, it's been shown, you can increase your testosterone level 200 to 300%. That's 2 to 3 times as high. So if you're low, if you're in that bottom range at like 250, you can increase that to 500 by exercise alone. The other nice part is it increases your growth hormone level at the times you're exercising. If you use the large muscles in your body, your chest and your thighs, that makes your growth hormone level go up substantially, which also supports testosterone. Not everybody can do it. The labs right now that we work with over the last years, they changed the range. The range used to be 250 to 1,200 points. That was normal for a guy. So that's a pretty big range, actually. I like men to be up around 500 to 1,000, and that I consider healthy. They actually changed that range down to 930 to under 230. So it's so epidemic. Low testosterone is so common that I'm kind of flooded with the need to help guys get this situation handled. So the way that we initially do it, we get them on a good diet, good supplementation. Zinc really helps with the conversion of testosterone from your mother hormones. The mother hormone is DHEA, dihydroepiandrosterone. It comes from your adrenal gland. You can take it as a supplement. It's super safe, 25 milligrams a day. Probably should get your level checked once in a while. For men, it's really safe. You can't really get too high a number if you're being reasonable, but get with your doctor on that and make sure that's good. Get your testosterone level checked. And if you're going to have to take supplemental testosterone, only bioidentical, never synthetic. So methyl testosterone or synthetic testosterone has been shown to cause heart disease, and it does, and other problems. Bioidentical testosterone is almost completely safe, with the only side effects, sometimes your blood count goes up and you have to have that taken care of by donating a little bit of blood. And if the doctor's not taking really good care of you and giving you the right mix, your estrogen level can come up and you can get some other issues with that. But a good doctor knows what to do with that stuff. Cream works, injection therapy a couple times a week, or my favorite is pellet therapy, where you get that done every 3 months or so. Careful blood monitoring 2 or 3 times a year, and man, it is lights out, so helpful. So many men who we treat, they say it just has changed their life completely. So get with your doctor on that stuff. Make sure your testosterone level is good. If you're not sleeping well, if you feel grouchy, if your energy level is real low, if just sexual function generally is just meh, just not really that interested, or you can't function real well, all those things have to do with testosterone. But the first thing that you're going to experience is you're just not excited about life. You just don't have that optimism or drive. And if that's going on, get that checked. It's not all about psych drugs and you having a mental problem. Sometimes it's just testosterone. Get with your doctor. We're better together.